Namaskar. I'm Dr. Anita Tripathi, Senior Pediatric Consultant in Medicover Hospital, Visakhapatnam. Today I'm going to speak about COVID-19 infection in the pediatric age group. There's a lot of anxiety now that a third wave is going to come and the children will all be affected. Please relax. Parents, don't get panicky because we have seen COVID-19 infection in the pediatric age group in the first wave. We have seen many cases of MERS-C, in fact more cases in the first wave. Now also we are seeing in the second wave many cases in the pediatric age group, in the newborns, in infants, and we have started now seeing MERS-C cases. And a third wave, we are apprehending, yes, the children may be affected more. That's only because beyond the 45 age group, we have given the COVID-19 vaccine. And in between 18 to 45 years age group, we have started giving the COVID-19 vaccine. And in children, probably trials are being started and we will be getting some intimation and information very soon. And don't get panicky about it. The only thing is you have to prevent the infection, and how? And what are the symptoms? What are the early symptoms and signs when you are going to meet your pediatrician or your doctor? COVID-19 infection, we know, affects one and all, starting from the baby in the womb, to the mothers, to the child, to the newborn, and the pediatric age group up to the 18 years of age. Below 18 years in a country, the population is about 41 crore and it's 34 crores below the 14 years age group. So just imagine our kids. So they amount to a maximum of our country's population and we have to take care of them. So we have to be prepared and the awareness of the parents should be there. If anybody at home is suffering from COVID-19 and if we have children at home, we should get everybody tested. And children may be having mild symptoms or no symptoms. But we have to consult the doctor, we have to get tested and we have to get treated if there are mild and minimal symptoms. But unlike in adults with whom we see the cytokine storm or seriousness requiring ICU care in between 1 week to 2 weeks, but in kids, in children, in the pediatric age group, we see the symptoms and signs which require an ICU care beyond 2 weeks of age. So don't think that my child was asymptomatic and now nothing will happen. We have to be prepared for any small sign and symptom beyond 2 weeks of COVID infection in the pediatric age group up to 2 months of age. That awareness should be there. Even if there is mild headache, vomiting or a fever for 1 or 2 days. Sometimes there may be diarrhea, blood in stools, blood vomiting. A child may come with respiratory or distress or breathing problem. There may be like jaundice or fits, or there may be a very fast breathing. There may be palpitations. There may be stoppage of urination. There may be a swelling of the body. There may be bleeding into the skin. Any symptom, we should think of MERS-C. What is this MERS-C? It is a multi-system inflammatory syndrome in children. This requires an ICU care, and if it is timely diagnosed and treated and managed, we give a symptomatic treatment and we give IVIG to required children. And if it's managed properly and it requires an ICU care, the child will definitely respond. So dear parents, please take care of any minor signs and symptoms in your kid during the COVID-19, or even if your child was totally normal, beyond 2 weeks of the infection, up to 2 months. Please be careful and aware. There are certain investigations, small tests which are required, maybe a small CBC, a CRP. You consult your doctor or a pediatrician, and we are there to guide you round the clock. And how to prevent this? First and foremost, we have to take care of the child's nutrition. Once a child is healthy, any infection is going to be of a lesser type, and the emergency requirement, it may be a bit less. Second thing is exercise. Nowadays, we are all in lockdown. The kids are not exposed to the sunlight, to the outside atmosphere, the proper oxygenation, the greenery, nothing. They are indoors. But at least a 30-minute exercise is required for an older child to remain fit. And thirdly is sleep. We should take care of the sleep because the body's growth and repair, it happens during this period. So rest is required for the body, minimum of 7 to 8 hours. And finally is mental health. Yes, the mental health of the child is very important. Don't discuss any negativity regarding COVID, the COVID deaths, regarding the infection round the clock, regarding the hospitalization. And apart from this, don't scare your baby. Don't allow them to see the internet round the clock or the TV or into different smartphones and other channels which usually show violence or negativity. Call them for your household work, for more of creative work, and keep them happy, because in olden days the kids were more happy doing maybe painting, doing knitting, writing novels, stories, small short stories, essays. Give them a lot of creative work and appreciate your child. This is going to keep them happy. And apart from all these things, we should not forget the SMS, social distancing, the mask and sanitization. With all these things, I think we can fight and overcome COVID-19 in children. Thank you.